One of the most common questions I get working with runners is, when can I run through pain? Great question, right? Maybe you have been asking that same question during your training or races, and you want to know for sure whether you're going to hurt yourself or whether you can push through it during key moments in your race. I get it, 80% of runners get injured every year. It's an unfortunate fact, and part of my channel here is to work to change that. But it's hard to know. It's hard to know whether running through pain is going to cause more injury or whether you can run through and potentially hit your PR. So in this video, I'm going to describe exactly what good and bad pain is, so you have a reference point to use when you do experience it. Hopefully you don't, but if you do, you can use this as a reference. Hey everyone, I'm Dr. Kevin Vandy, running specialist physical therapist in San Jose, California at Competitive Edge Physical Therapy. Again, this video came about because I've just had a ton of runners reaching out asking me, is this pain good? Can I run through it? Am I going to hurt myself? You've probably asked those same questions. So let me dive right in with what is considered bad pain. So oftentimes, if you think of the pain scale 0 to 10, 0 being no pain at all, 10 being gotta go to the emergency room, bad pain is anywhere 7, 8, 9, and 10, so in the upper end of that range. When the pain is that high, it's signaling that a tissue is very much overused, in the damage or overuse range, and your body's telling you, hey, it's time to stop. That usually is associated with sharp pain. So it's like stepping on a thumbtack, or nerve pain is considered sharp, or when you first sprain your ankle, that's considered sharp pain. That's also a pain you want to pay attention to and probably not run through. Whereas a dull pain or ache pain might be, you have a quad cramp, might be your calf is burning from maybe training errors or electrolyte issues. That's okay. But if it's sharp pain, pain that makes you wince, pain that makes you limp, pain that makes you change your running form, that's pain you want to either adjust and take a break, or potentially, if need be, bow out of the event. If it's that sharp, again, 7, 8, 9, 10 on the scale, or sharp, that would be considered pain that's potentially going to cause injury. Other pain you want to be cautious of, if the pain increases during your training event, let's say it starts at a 3 and then goes to 5 and then goes to 7, that is your body's warning system telling you, hey, this is too much. This is going to become an injury. So usually in those situations, if you stop, rest, stretch, move, that might be able to take it away. But if it continues to progress, that's also a sign of bad pain that could lead to injury. How about if you have pain during an event or during training, and then the next day it's even more painful? That's something you want to watch out for too. If the next day you wake up and you're limping, it's worse than the day before, makes it so you can't run, and that happens a couple days in a row, that's also pain you want to pay attention to and reduce your training, or take a break from training and seek help from a doctor, physical therapist, running specialist, so they can figure out what is going on with the pain. Now, sometimes you get a side stitch, sometimes you get a muscle cramp, sometimes mentally it hurts because you're having to push through the self-imposed barriers in your mind. Those are all pains most people can run through. Cramps with some water and some stretching and slowing your pace you can usually run through. Side stitches, focusing on big inhalations through your nose and breathing long exhales through your mouth can help reduce side stitch pain. So what's good pain? What's pain that you can run through? It's pain lower down on that scale, anywhere from 0 to 6 usually is okay to continue to run through, so long as it's not progressing or sharp. Pain that doesn't cause you to limp or change your form. Pain that is dull or and a low-grade ache, again, not sharp. Those are all pains where you can run, and especially if the pain doesn't increase. If the pain just stays, that's also something you can push through, especially if it's a key race or event. If you wake up the next day and there's no pain or less pain than you had during your training event, that's also a sign that the pain isn't yet going to cause an injury or issue. So again, those are the parameters for whether you can run through pain or run not through pain. As long as it's not 7 to 10 out of 10, sharp, it doesn't increase during the event, it doesn't cause more pain the next day, and doesn't cause you to limp, change form, or make adjustments, that's pain you can push through without substantially increasing your risk of injury. Again, as a runner, pain is common. You're going to have it. You're going to experience it. You're going to have to push through it at times. Hopefully, this guide is going to give you some parameters of how you can stay mentally fresh and have the awareness to say, it's okay, I'm going to continue to make the choice to push on, or you know what, this is a little bit too much, I'm going to bow out until next time, rest and recover, and see a specialist. Again, injury is probably the most common thing that's going to take you out of your training, and you want to avoid against that. And sometimes it's as simple as just listening to your body and making sure that when you're hot, and you're maximizing your training, and when there's injury, you pay attention and you see a specialist. Hey guys, I hope you enjoyed this. If you got value, drop a comment below letting me know this helped, or any other tips and tricks you've used to assess pain when you're training. Hey guys, please hit like, subscribe, hit the notification bell to get more of my videos. And until next time, train smarter and perform better.